Rita, I had a client, male client. I remember, we were talking together in the room, and I said to him, so, it sounds like you don't feel safe a lot of the time. Tell me a time when you maybe have felt safe. And he had to think for a minute, and he said, I think the only time I've ever felt safe was in the inpatient unit I've been in. So it's all very well for me to say to that client, it's safe here with me, but actually everything in his body tells me it isn't safe. And when there's a conflict between what I know and what I feel, the body always wins. So, how do we help our clients have felt safety in the room with us and even in their own body? I'm Ruth Holt.
And I'm Rita Younan, clinical psychologist, advanced schema therapist, supervisor trainer. And this is our 7 minute schema series. And we're here to talk about, things related to schema therapy, whether it's training, research, or treatment.
Yeah, so today we're talking about how do we help our clients regain safety, when they've had so many difficult experiences. Many have had incredibly traumatic experiences where the world was not safe, people were not safe, nothing felt safe. How do we help them regain that safety? And of course, that hones right in on that schema, mistrust, abuse. Remember that schemas have four parts. There's the thoughts we have in when we're in that schema, there's the feelings, there's the memories, and then there's the body sensations. And today we're really focusing in on how to take notice of a lack of safety, a mistrust, abuse schema, or vulnerability to harm schema that's held in the body.
Yeah, that's a really good point, Ruth, in terms of, what you and I talk about, the somatic signature of the schema or the mode. How do you start to pay attention to those subtleties that are in the room? And I think as practitioners, we're not really trained in that way, to really kind of notice the posture of someone's body and how to work with that process. And so, if we think about, for example, a mistrust abuse schema that will be perhaps held by a vulnerable child, what kind of body signature is that going to look like?
Yeah, so it can be that real agitation, the fiddling with fingers, maybe even that kind of shrunken, pulling away. There can be a lot of information you can get from just noticing how the client's holding themselves and how they're reacting as you're talking.
Yeah, and I guess what you're describing too is that you've kind of given the patient this idea that the room is actually safe, but they walk in and, just kind of sitting opposite a practitioner. Stephen Porges, the founder of the polyvagal theory, talks about this idea that your body immediately neurocepts danger. That even though their head's saying it's okay, why is my body doing this? Why do I feel so unsafe? And Bessel van der Kolk, and again, another expert in the trauma field, talks about this idea of how do we recalibrate the nervous system? And we do that by working with these particular people and trying to get them to shift how they may be sitting, their posture, noticing the difference, and trusting that they are safe in the experience in the room.
Yeah, so calling attention, perhaps actually saying, I'm noticing you say it feels okay to be here, but your fingers are really working hard right now. I'm wondering if that part of you, that's sitting in the room there's a part of you saying, I'm not okay, I'm not safe. And I wonder as we call attention to that, I wonder if we kind of put those fingers, like maybe hold them just really gently and softly. How does that feel? What are you noticing? So we're not trying to force a client to do something. We're trying to get them to be aware and curious.
And notice, does it feel better? Does it feel worse? If that doesn't work for you, how can we make it feel better? And trying different interventions. One of the things that you and I talk about in our complex trauma workshop is this idea of introducing a safety item like fleece, which Joan Farrell and Ida Shaw talk about in their group schema therapy program. So adding something and seeing whether that creates a felt sense of safety. And when they have that felt sense of safety, where is it located in the body? Where is the body giving you that impression that this feels okay?
And all of those things you're talking about are attunement, aren't they? We're mirroring in that limited reparenting relationship what we would like our clients to have all had. Somebody who really deeply cares, who connects, who notices, who shifts and attunes to what the child needs. And so as we do that in a subtle way, but as we also call attention to the fact that we're doing that to increase the level of safety, we can then start to rebuild step by step those pieces of safety that have been missing.
As a result of those, early attachment injuries and creating some kind of regulation or co-regulation within the room that I can feel safe in the presence of another, and I can trust that I can feel safe in the presence of another.
Mm. So we can even ask, what is it that I do that kind of increases your sense of safety? What is it that I do that decreases your sense of safety? For some clients, then their neuroception of a smile is that that's dangerous. So if we might be smiling and trying to really engage, that may actually increase the sense of threat in the room. Things that are even outside the room that we might want to think about helping our clients with is giving them some ways to have a safe part of the house. So they may have, one of the interventions that Boone and Steele, Vander Hart talk about is having an anchoring point in each room of the house, getting your clients to go and find one part of each room that they can use as a centering and grounding tool to remind themselves of the year and it's okay, that I'm safe.
So one of the things that, just kind of based on safety at home, Ruth, I've talked about my patients, creating a safety corner at home, somewhere where if they are experiencing some flashbacks or trauma or need to go somewhere safe, just like we do in group schema therapy, actually, that they have somewhere that they can just kind of, create a sense of safety and stability. One of the other things just in session though, going back to this idea of somatic signature, when someone's really fused with their critic, for example, they might be in this real kind of collapsed state. And one of the things that we can do, like you said, is kind of bring that to their awareness that they're in this collapsed state. And if we ask them just to kind of lengthen their spine, what do they notice happens? Does it give them a sense of strength or empowerment, or does it feel uncomfortable? Because if I make myself visible, what does that mean? And for some people in that shame posture, that was the way to be unnoticed. So lots of different ways in which we can bring the body into the room to help with the clinical interventions that we use in schema therapy.
Well, that's great, Rita. That's also our 7 minutes. So feel free to leave your comments or questions at the bottom and follow the link if you're interested in more training.